So when we look at the cognitive functional therapy, the functional aspect, how does that differ to conventional physiotherapy, who, claim to be functional in their rehab anyway?
Yeah, so there are probably some key elements of this. We don't do a traditional examination. Typically someone comes in with back pain, and we were taught to look at forward bend, backward bend, side bend, combined movements, a bunch of tests, etc. The things that we look at in the examination are guided by the patient. So if the person says, I can't roll, like I had a case yesterday, her problem is in bed. She's like, every time she rolls over, she has pain. So I'm interested in what she does when she rolls. Another person who presents, their problem is they can't run, and that's their goal. So I'm interested in how they load their body and how they engage with running. For other persons, it's bending and lifting. It might be a ballet dancer where they can hyperextend. They are the things I'm interested in. And so the examination is entirely functionally targeted around the things that are important for the patient or their barriers to re-engage in valued activities of living. And the intervention is targeted in the same way. So we use guided behavioral experiments where we take people back into feared, avoided, or painful activities and movements and look to see whether we can modify the way they perceive their body, their building confidence in their body, relaxing the body, changing the way they move to build pain control strategies and confidence to re-engage with those movements. And so that looks really different than a generic exercise program. 20 years ago, I was giving transverse abs and multifidus training in a non-functional position and then taking it into function. That is not CFT. CFT is not about training individual muscles. It's about building confidence in the body to re-engage in things that that person values and doing it in a graduated way. So we use some traditional concepts around graded activity, strength-based training, endurance training, where it's needed for that person to get to where they want to go.